Dietary and lifestyle modifications are essential for people with diabetic neuropathy because they can help to prevent the disease from progressing further. One of the most important ways the diabetics can slow the progression of their neuropathy is to achieve better control of their blood sugar levels. Diet is one of the main ways that people with diabetes can control their blood sugar levels without taking additional medication. By eating well-balanced meals with a mixture of fruits, vegetables, proteins and fats, you can help prevent major swings in the blood sugar levels. Eating meals on a regular schedule and coordinating the meals with your diabetes medication can also minimise the blood sugar fluctuations. In addition, specific dietary patterns like high-protein, low-carbohydrate diets or diets rich in foods with low glycemic index have been shown to improve the blood sugar levels. A healthy diet also helps diabetics to lose weight, and this has been shown to help to keep the blood glucose levels low. Notably, a study found that making dietary changes to help to keep the blood sugar levels under control reduced the diabetic neuropathy symptoms in patients with impaired glucose tolerance, which is considered to be a pre-diabetic condition. Ideally, most people should target a fasting blood sugar level between 70 and 85 milligrams per deciliter, although this can be difficult for diabetics to achieve. Regular exercise is also important for people with diabetes. Exercise causes muscle tissues to burn energy, and this prevents the blood glucose from rising too high. Regular physical exercise also helps the diabetics to lose weight. This improves the overall blood sugar levels. In addition, one study found diabetics who increase their physical activity levels and lose weight have increased numbers of mitochondria in their skeletal muscle fibers, and this is important because the mitochondria help to generate cellular energy. Consequently, this increased mitochondrial density would allow the diabetics to burn energy more quickly, helping to keep the blood sugar levels lower even when they're not exercising. One study also found aerobic exercise in the form of walking on a treadmill for 4 hours per week was able to slow the progression of diabetic neuropathy. Another dietary and lifestyle intervention that diabetics can use to prevent diabetic neuropathy is to improve their overall cardiovascular health. The impact of cardiovascular health on diabetic neuropathy has been established in many studies. Diabetics who have high blood pressure, elevated LDL cholesterol levels, and high triglyceride levels are more likely to develop the diabetic neuropathy. Studies have also found high triglyceride levels can cause nerve damage even in non-diabetics. 2 different studies found that patients who followed a program of increased physical activity of 150 to 175 minutes of exercise per week, weight loss, sustained loss of 7% of their body weight, and a low-calorie, low-fat diet had lower blood pressure and triglyceride levels, suggesting that these lifestyle changes could help prevent diabetic neuropathy. Elevated blood glucose drives complications of diabetes, including neuropathy, via several mechanisms. For example, the high glucose promotes inflammation as well as glycation, and it perturbs the blood flow to the neurons, all of which contribute to the neuropathy. Unfortunately, most conventional drug treatments aim to provide symptomatic relief without targeting the underlying mechanisms. However, several interventions have been shown in studies to modulate the biological pathways that underlie the development and the progression of neuropathy. Thus, by taking steps to keep fasting blood sugar levels within the optimal range of 70 to 85 milligrams per deciliter, and supplementing with natural compounds to mitigate the negative effects of the excessive glucose, one can ensure a robust defense against the diabetic complications. Honokiol is a polyphenolic compound from the bark of the magnolia tree. The magnolia bark extract has been used traditionally as a sedative to improve sleep and to relieve anxiety, and the honokiol is being investigated for its potential usefulness in treating inflammatory pain. Like other polyphenols, the honokiol has oxidative stress reducing and anti-inflammatory activities. In addition, it appears to cross the blood-brain barrier and to interact with certain neurotransmitter receptors within the brain. Lab research shows the honokiol and some of its derivatives activate certain GABA receptors, and this might also interact with the receptor for glutamate, dopamine and serotonin, and influence acetylcholine signaling. One form of Honokiol has even been shown to stimulate the cannabinoid receptor that might be involved in decreasing pain perception. In one study, the treatment with Honokiol reduced pain-related behaviours in mice in experimental models of inflammation. Findings from other animal studies indicate that Honokiol can decrease acute inflammatory pain without causing motor or cognitive side effects, and it might prevent and decrease some of the chronic pain-related changes within the brain. PEA, or palmitoylethanolamide, is a lipid compound, and it occurs naturally in the tissues throughout the body, including the central nervous system. It can also be found in foods like soy lecithin, egg yolk, and peanuts. A growing body of research suggests that PEA supplementation can be effective for relieving pain from a variety of causes without triggering adverse side effects. Most of the existing preclinical research indicates that PEA works by changing the expression of certain genes and reducing inflammatory signaling, but other possible mechanisms for its analgesic effect have also been proposed, including its ability to stimulate signaling through the cannabinoid receptors in the nervous system. Several clinical trials have shown that PEA can reduce pain from a broad range of causes, including diabetic neuropathy, chemotherapy-induced peripheral neuropathy, sciatic nerve compression, carpal tunnel syndrome, osteoarthritis, lower back pain, failed back surgery, stroke-related nerve pain, multiple sclerosis, dental pain, chronic pelvic pain, post-herpetic neuralgia, and vaginal pain. In an observational study of individuals with chronic pain due to a variety of conditions who were unable to control their pain with the usual therapies, adding 600 milligrams of PEA twice a day for 3 weeks, followed by once a day for another 4 weeks, decreased the average pain intensity scores in all participants who completed the study. In a randomized control trial, 636 participants with pain due to compression of the sciatic nerve received either 300 milligrams of PEA daily, 600 milligrams of PEA daily, or placebo in conjunction with their usual pain medications for 3 weeks. Both doses of the PEA resulted in greater pain reduction than the placebo, and the higher dose was more effective than the lower dose. In fact, those in the 600 milligram group experienced more than a 50% reduction in their pain scores. In 118 patients with nerve pain, 30 days of standard treatment plus 600 milligrams of PEA was more effective than the standard treatment alone. A randomized clinical trial found 900 milligrams of PEA for 1 week, followed by 600 milligrams per day for 1 week, was more effective than ibuprofen at a dose of 600 milligrams 3 times a day for 2 weeks, for relieving TMJ pain. Micronized preparations of PEA have also been studied. The micronization results in smaller particles, and these can be absorbed more readily. The micronized PEA at a dose of 600 to 1,200 milligrams per day reduced pain in subjects with diabetes or trauma-related nerve pain, chronic pain after failed back surgery, and acute pain from tooth extraction. In a report of the 100 cases of nerve pain related to spinal disorders, the inclusion of an ultramicronized PEA supplement in pain management showed promising results. A meta-analysis found women with chronic pelvic pain due to endometriosis appear to benefit from the combination of 800 milligrams of micronized PEA per day plus 80 milligrams per day of polydatin, a natural free radical reducing agent that's found in grapes and red wine. In a randomized control trial, the combination of PEA and polydatin was more effective than a placebo for reducing abdominal pain in irritable bowel syndrome patients. Lipoic acid is a compound produced within the body, and it exerts a variety of beneficial effects within the body, especially in the context of glucose metabolism. In fact, lipoic acid is an approved treatment for diabetic neuropathy in Germany. In addition, it appears that lipoic acid can positively influence glucose metabolism in people with diabetes. Important mechanisms by which lipoic acid helps to combat diabetic neuropathy include the inhibition of glycation and inflammation. It's also been reported that lipoic acid can protect against oxidative damage in neuronal cell cultures. It also improves blood flow to the nerves and allows them to use energy more effectively. In animal studies, lipoic acid has been found to prevent and even to reverse nerve dysfunction caused by high blood sugar. Results of clinical trials have been promising. One trial showed that 3 daily doses of 600 mg of alpha-lipoic acid over a 3-week period led to significant symptomatic improvement in 12 patients with diabetic neuropathy. In another trial, 181 patients were divided into groups receiving a placebo, or 600, 1,200 or 1,800 mg of alpha-lipoic acid per day. Significant symptomatic improvement was noted in the 1,800 mg per day group in as little as 1 week. With the 600 and 1,200 mg groups, the improvement was noticed by week 2. In both of these trials, sensation of pain and the burning were alleviated. A separate study found the oral administration of 600 mg of lipoic acid every day over the course of 4 years improved neuropathic symptoms and slowed the progression of mild to moderate diabetic neuropathy. Another trial showed intravenous lipoic acid is also beneficial for diabetic neuropathy. One study revealed daily intravenous administration of alpha-lipoic acid for 3 weeks is an effective treatment of diabetic neuropathy, and another trial reported intravenous administration for 2 to 4 weeks was efficacious. Lipoic acid is available as a supplement in 2 forms, alpha-lipoic acid and R-lipoic acid. Evidence suggests the sodium salt of R-lipoic acid might be more bioavailable than the alpha-lipoic acid. To learn more about diabetic neuropathy or anything mentioned in this video, or to learn about herbs, supplements, natural treatments, or to book a consultation, check out my website.